Welcome back to Yahoo Finance Live. The nation's two largest school districts, New York and Los Angeles, announced plans to return to schools in full, reopening this fall. And a lot of experts are cheering that because the return to normal couldn't come soon enough when it comes to the mental impacts we're seeing play out on school children across the country. Even beginning the pandemic back in March of last year, parents were already complaining about the impacts their kids were suffering in a shift to remote learning. So how much worse has it gotten after more than a year? Joining us for more on that is California State Superintendent of Public Instruction, Tony Thurmond. And Superintendent Thurmond, appreciate you being here with us. I mean, talk to me about what you've seen up close and personal in the impacts on kids thus far.
There's no question this has been probably the toughest, time that most of us will experience in our lifetime. And our kids have felt it like the rest of us. We've been socially isolated, and we've seen among our students an increase in depression, in some cases suicide. And so we know that right now, the most important thing we can do, especially as we're celebrating Mental Health Awareness Month this month, is to provide support, mental health support, and social for our students.
I imagine part of the challenge is also being able to track down some of these students at a time when things have been done so remotely. I know in the early days of the pandemic, schools were already reporting students going missing. How are you thinking about trying to ease back into these in-person classes, at least looking at their progress from a mental awareness standpoint?
It's true. We spent the early days literally making phone calls, sometimes doing home visits, trying to find families that didn't check in for school at all. And we're seeing significant decline in enrollment overall, even as we're prepared to open our schools in person for in-person instruction in the fall. And so we've got to figure out a way to re-engage our families, bring them back. Some of our families are afraid to come back. We've seen this in the Latinx community, in the African-American community, communities that were the hardest hit by the pandemic, and those who lost, family members, many are concerned about coming back, but we're sending messages to families that we have access to vaccines and rapid COVID tests, that it's safe to be back based on the research that we now have. And we're doing outreach with families to welcome them back. And our state right now is working through what might be a $3 billion investment in mental health services for young people from birth through age 25.
Yeah, because that's a big aspect of this, obviously, right? It's not just getting back into school, but if you have those emotional scars from this, the mental health services piece of it's going to be rather important. So, I mean, funding's one good thing, but how do you kind of drive students or families to actually take up using that if maybe before it was something they never really considered or knew was available?
We're doing a lot of education on how to counter the stigma about mental health. A lot of folks don't think about it, but millions of Americans, live with mental health challenges even before the pandemic. And we have a robust mental health services system to help them. We have to work through stigma. We have to make sure families are aware of it. One of the biggest challenges in the pandemic, the limit on computers and access to the internet also meant limits on telehealth for families who would need access to mental health providers. And so we're working on every aspect that you can imagine. We got to get more counselors, and we've got programs that we're focused on for that. But we have to make sure that those who can't engage in person have access to high-speed internet. We have to provide training to families. We have to do it in multiple languages. Our schools, are very diverse, and we have to do that in multiple languages to help families recognize it's confidential, it's supportive, it's secure, and it's really going to help us to deal with this trauma that we've been dealing with for the last 14 months, known as the pandemic.
The mental health aspect of this, just one piece of what I imagine is a very layered logistical process going into the fall as you look to a full reopening. How do things look from a staffing standpoint right now? And where do you see the most complications as you sort of move ahead with the opening, but also make sure that students can remain safe in classes?
We have 1,000 school districts in the state of California serving 6 million students. And so some of our districts have said their staff are so fatigued that they can't get substitutes to work. They can't find staff who will work in our summer school programs. And so, we've got a lot of efforts to recruit and retain more educators, looking at ways to bring back some retirees. We We have to provide training and professional development to all of our staff. Let's face it, our teachers and our classified staff, our school staff, they also have experienced trauma. Coming back to school, even though we can be open, we know that things are going to be really different, and we need to consider that as well. If you're coming back to school and you're wearing a face mask, there's some social distancing. As a people, we're not used to being distanced. We're used to being connected. And so our social emotional support programs have to be for teachers and for classified staff and for students and families. And the most important thing that we can do to help our families feel safe is to make sure there's more uses of the vaccines. Right now, our focus is on teen vaccines. We're doing outreach. We've got celebrity spokespersons helping with that. We've surpassed nearly 40 million vaccine doses in our state. But we know that we have to do more to get our young people vaccinated. That's probably the biggest thing we can do to get everybody back and feeling that it's safe to be back in our schools.
Yeah, as we're seeing more and more younger Americans, teenagers now receiving that vaccine as well. But Tony Thurmond, California State Superintendent of Public Instruction, appreciate you taking the time here to chat with us today.